Hi, my name is Renee, and I am here today to hang an IV of 0.9% sodium chloride in isotonic solution for my patient Marilyn Hughes, who is suffering from some dehydration because she had diarrhea and vomiting for a few days. So we're going to make sure we replace the fluids and electrolytes she's lost. So I am going to gather my supplies. I have them here. I have my solution. It's 0.9% sodium chloride. I'm checking for color and clarity, and I'm squeezing it to make sure it's not leaking. And I'm looking at the expiration date, which is good. And I also have my tubing, my primary tubing, and that's good. And I have my IV flush to flush the port on the site on her arm. And I've already put a label on my tubing. I just have to fill that out. And I'm going to go into the doctor's orders first. And I'm going to make sure that the orders match my solution. And I'm checking to make sure I have the correct patient, the correct medication, the correct volume, and I'm looking at my infusion rate, and it's the right time for her IV solution, so that's all good. And I'm looking at allergies. She only has an allergy to gabapentin, so there's no contraindications there for her to have this. And now I'm also going to go into the MAR, and I'm going to make sure that I have, again, the correct solution, 9% sodium, 0.9% sodium chloride, and it's the same volume, rate, and it's the right time. Everything looks good. So now I am going to go see my patient. Hi Marilyn, my name is Renee, and I'm here today to hang an IV solution of sodium chloride to replace the fluids that you've lost recently because of the diarrhea and vomiting. Okay, I'm going to perform hand hygiene, and I'm going to put on my gloves. Do you think you could just tell me your name and birth date? Thank you. And do you have any allergies, Marilyn? Okay, great. I'm going to establish some privacy here, putting the curtain up. And I am going to hang this, taking out my tubing. And real quick, I'm just going to scan your bracelet. I'm going to check your allergy bracelet. And just going to scan that. Thank you. And you can scan the medication. That's that. And I'm going to check one more time now that I'm here, and just make sure that I have the correct medication, the correct patient, the correct volume, the correct time and dosage. And that all looks good. So, important is not to compromise the pick, the spike, or the port that it goes into. You have to maintain aseptic conditions. So put that in. And I'm going to squeeze the drip chamber and make sure I have that half full. Then I have to prime the tubing, make sure I get all the air bubbles out of it. here. And I think that looks great. Close off the clamp. Put my cap back on. All right, I'm going to just put this in right now. I'm just going to hang that there, and I'm going to assess the site where I'm going to infuse the fluids, and it looks good. It doesn't look swollen. There's no bleeding or anything, so that looks good. Is there any pain there at all, Marilyn? Does that feel okay? Okay, great. So I'm going to clean the port on that. For 15 seconds, and then I'm going to flush that. And I'm just going to do 3 milliliters. Clean that port one more time. Too big. Clip is opened. Okay. Now I'm going to program the pump. Picking 0.9% sodium chloride, and my infusion rate is 50 milliliters per hour. My volume to be infused is 1,000, but I'm going to set the pump at 950, so I have time to change out the bag. And I'm going to make sure my clip is open. And start that. All right, Marilyn, let me know if anything feels uncomfortable at all. And that's starting to drip. So just want you to pay a little bit of attention to that. I'm going to be checking in on you quite often to make sure it's okay while the medication is infusing. But if you start to feel like you're getting swelling or it's painful at the site, or you notice any leakage or bleeding, call us right away with your call bell, okay? Do you have any other questions? Okay. All right, that seems to be going well. I'm going to perform hand hygiene and give you your privacy.